Hey guys, I'm Ernest.
And I'm Lauren.
Welcome to the Dear Retirement Podcast Show. All right, so the question of the day is, if I am purchasing a Medicare plan, how do I know if I chose the correct plan or not?
It's a great question, and we get that a lot, don't we?
We do.
So there's so many different things that you have to consider. Number one, I would say, do your doctors take it?
Well, before we even do that, that's a good point, but there's a lot of good points. So what I think we should do is, why don't we discuss different scenarios?
Okay.
We can't really discuss actual plans. There's different regulations, but we can discuss scenarios, and we can show you some of the things that help us determine what's going to be the best plan or recommendation on our behalf for the client.
Okay. Yeah, let's go. So scenario number one would be?
Okay, so what if we have a client that he likes his plan, he likes his company, but this year it's in his best interest to look at a plan that's going to give him some money back.
Okay.
We do this all the time. So, I mean, we do this all the time. So there's certain carriers that are available in your county that the benefits match up pretty much identical to the plan that you had before. However, this year you might get what's called a Part B buyback. And we've seen buybacks as high as $150 a month. So that would go back to your Social Security check. So that's what I'm talking about.
Okay. Yeah, well, to make sure that that's the right plan for him, number one, we would check doctors.
Sure.
Number two, we'd check prescriptions.
Mm-hmm.
And if all those check the boxes and everything else lines up, then it's green light.
That's right.
As long as,
Well, and I do the same thing, because we have family members that are a part of Medicare, so we're always talking to them about, okay, so there are multiple $0 plans, but my family members, especially when you have two members, that can be $100 a month times $200 a month. That's $2,400 a year. That can be $3,600 a year, depending on the plan. So that might be a scenario. That might be something that you want to ask your advisor about, or you can reach out to us as well. But that's that's one way. So what would be scenario number two, Lauren?
Let's say you have somebody who needs some dental work done, and they had to pay thousands of dollars previously to get some different dental work done, maybe root canal, crowns. I don't really know what the cost for specific things are, but so let's say 2021 they paid $4,000 for dental work. So now they're looking for a plan that's going to cover it. It's not going to be any headaches. They know their doctor or their dentist is going to take it. So
No, go ahead. I'm sorry.
So that's the scenario. Now it's dental first. Like, they don't really care about any of this other stuff.
Mm-hmm. Dental's big. There's also programs this year that are covering implants. Those didn't exist before. I think that, and this is why it's important to check your benefits every year, because there could be one year where dental is not as big of an issue, but then the next year you don't want to have to go to the dentist and he says, okay, that's going to be $4,000, and you're stuck in a plan that's not going to cover it, and you have to use your life savings. So if a client knows something's coming up or there might be some changes, it's important that you talk to your broker, because there are programs now that are giving you $5,000 and upwards of $5,000 into unlimited dental. And this is with the Medicare Advantage plan. Scenario three. A lot of people don't understand the difference between a Medicare Advantage plan and a Medicare Supplement plan. So it's important that we go over that with our clients each year. And there are times to when it's important for our clients who have Medicare Advantage plans to look at a Medicare Supplement plan while they still have their health. And it's also important for our clients to look at Medicare Advantage plans if they get unaffordable, because you recently ran into this, right? Don't say the person's name.
No names, but recently ran into a situation where a client has been on a Medicare supplement for almost a decade, and the rates are increasing. It's getting high, and almost to the point where it doesn't make sense to have it. So we're now looking at a Medicare Advantage plan to see if there's one that's going to give great coverage but have a low out-of-pocket or a maximum out-of-pocket and I think we can find one that's going to have a maximum out of pocket that's actually less than what the annual cost of having the supplement would be. So if we can do that, make sure, number one, are the doctors going to cover, or are the doctors going to take it? Are the prescriptions covered? If both of those boxes are checked, yes, then I feel confident moving forward that it's going to be a good decision.
And let's discuss what Lauren just talked about. So the Medicare supplement plan is the plan that you can go to any doctor, any hospital. It's basically a federal program. Doctors have to accept it if they accept Medicare, unless they're a pediatrician. And with that program, a lot of people like that plan because you have more access to doctors and hospitals. However, if you're in a situation to where you're paying, let's say $300 a month, and you have some pre-existing conditions, and you're seeing that might be unaffordable, you can look at a $0 plan. And this is what the annual enrollment period is about, to where you can pick a $0 plan, and we can help you pick one that has a lower maximum out of pocket. There's some programs right now that have a MOOP, which is a maximum out of pocket of $1,500 for the year, and they call those. It's considered like a Medicare Advantage hybrid plan, but for those clients, once you meet that $1,500, everything else is going to be covered for the rest of the year as long as you're in network at 100%. So it really is something that you need to look at. Hopefully this is making sense. I do it all day, every day. But I'm hoping this makes sense to you guys.
If we were to just quickly say UB supplement, IB, an Advantage plan, and let's just quickly let's talk about differences, and we can put this up too later, like have it over by my shoulder or something. So as far as, what did I say you are, supplements?
I'm the supplements. Okay. I'm strong. I'm robust. Did you? Okay, that was weird. Did you hear something at the door?
That was your hand on the table.
Oh, okay.
Let's talk networks first. So he is a supplement. I'm a Medicare Advantage plan. We're talking networks. What do you have to say for yourself, Mr. Supplement Plan?
Well, I'm a strong supplement plan, and I don't have a network. I can go anywhere I want as long as the doctor accepts me there, Missy. That's what I can do. I can go, guess what? Every time I go to a doctor, they have to accept me every single time. Because I'm a supplement.
I didn't know we were doing voices. Okay, so what he said in his cowboy southern drawl there was that supplements are non-network plans. You can go anywhere. So if you travel a lot, that's something to consider. Now I'm Miss MAPD over here, and we are either in I can't do this. HMO or PPO. So you do have to stay with the network, and you have to make sure that your doctors are in the network with that plan and contracted with that plan. And with the PPO, you can go outside of the network, but you are responsible for a higher cost share. So your copay may be higher, or it may be a percentage of the visit or the procedure that's being done that's going to be higher than if you were in network. HMO, you got to stay in the network. All right, so that was network discussion for that. How about prescription coverage? Do you cover prescriptions, Medicare supplement?
Well, no, but I have a friend that does. His name is Part D. And I swear, that Part D, man, he's a great fella. He's cheap, too. He's awful cheap, depending on if you don't take a lot of prescriptions.
Okay, so... But MAPDs, that's the D, Medicare Advantage prescription drug. Medicare Advantage and prescription drug, MAPD, comes with a prescription drug plan built in, so it's all encompassing.
Yeah, so when you have a supplement, you have to get a Part D plan. There are, and I was joking, but Part D plans, if you don't take a lot of prescriptions and you're just dealing with generics, you really need to make sure that you're paying a low premium. Mm-hmm. Now, if you have a lot of name brand drugs, or we really have to shop the marketplace for you, we're going to pull out a whole list of all the prescription plans. We'll be able to show you what your cost analysis is for the entire year. That way we can help you choose what's going to be the best prescription plan for you. Keep in mind, there's over 2,000 prescription plans out there. There are so many. So you really want to make sure that you have some type of an advisor to help you pick the right prescription plan. And this is where we find a lot of our advisors. I don't want to disparage anybody, but they just don't do their true due diligence.
Not when it comes to prescription drugs.
No, they really don't. So but So that's just something that we can bring to the table to where we can definitely add some value, because that's all we want to do. We want to add value. That's how we build our reputation among the community, and that's how we build our reputation with our clients, is by adding value. And but we don't accept phone calls on Sunday. I promise you, don't call us on Sunday.
Can we start?
No, we've been getting a lot of clients that call us on Sunday.
Somebody call it is at 10 o'clock on Saturday night. But okay, so we've covered prescription drug networks. What about co-pays and co-insurance? Like, how much is someone going to pay on a supplement when they go to the primary care doctor?
Okay, so it depends on the supplement you pick. So
we're going to talk about Plan G right now. Let's talk about just Plan G.
Okay.
Because that is the most popular one.
So the most popular supplements are Plan G and Plan N. Now keep in mind, there's no network with these supplements. So you do have that peace of mind knowing that you can go to any doctor, any specialist. With the Plan G, the new Part B deductible is $226. You pay 20% out of your pocket until you reach $226 on an annual basis, and then everything is covered at 100% for the rest of the year. Now, with the Plan N, it works similar to a Plan G, except that you are responsible for something called excess charges. And those are charges to where like a specialist might charge a little more for his procedure, but you still have to pay 20% until you reach your Part B deductible. And then you have a $20 copay each time you go to the doctor, and a $50 copay when you go to the emergency room. There's a little bit of a price difference, but Plan G still seems to be the supreme plan this year. And it just gives you that peace of mind, especially if you're coming off of paying for health insurance. My dad, when he was 64 years old, he was paying something around $1,000 a month in health insurance coverage just for him. He had already had some heart procedures. And when he got to Medicare, because of the fact that these plans are highly subsidized, like by the government, by the fact that they've been taking money out of your checks since you first started working. A lot of times when we do our seminars, I raise my hand there and I say, how many people started working before the age of 16? Everybody raises their hand because you guys are baby boomers. So at that point, I let them know that Medicare was taking money out of their checks at that moment up until this point that they're now going into retirement.
Okay.
Is that too much?
So as far as Medicare Advantage plans, there are copays. And that's one of the biggest differences between an Advantage plan and a supplement. Most of the Advantage plans have a $0 copay for primary care doctors. Specialists could be anywhere from, I've seen some that are $0 up to $50, $60 each time you go to a specialist. There's copays for emergency room, copays for urgent care. You'll have copays anytime you have like diagnostic testing, x-rays, any type of lab work. It just depends on the procedure and the type of facility where that particular procedure is taking place. But you will have those out-of-pocket costs to consider. So I think that's one of the biggest differences. Other than network, it's those like little out-of-pocket costs that can add up. So if someone's going to a specialist a lot, and we talked to a lady recently who was going to a specialist 3 times a week, those specialist copays can really add up.
Yeah, they absolutely can. There are some plans that have lower specialist copays, like you were discussing, and some of these are new. So there's programs here that are here this year that have these lower copays that weren't there last year.
Right. Yeah, this is the first year I've seen a PPO with a $0 copay for specialists.
Yeah,
that's low. Obviously it's low. It's $0, but
is that a monthly? Is that a $0 monthly premium?
It is.
Okay, so keep in mind, guys, we're being vague on purpose. I know if we're going to look at this back, and I hope it's not confusing, but we're being vague because CMS does not allow us to
talk about specific plans.
Yeah.
So we're giving broad information right now, and hopefully we're giving valuable information because that's always our goal. But I think always trying to get people to understand the difference between a supplement and an Advantage plan. That's key because even now we'll have people say, well, I have this plan, but my friend down the road has this, but she's getting all these other things. Why is that? It's because you're on completely separate types of plans. So talking about the extras, Ernest, let's go into that. Like some of the MAPD plans can cover things like dental, vision, over-the-counter products that you can order from a catalog. and transportation. Is any of that covered in a supplement?
If it is, it's barely. So there are a couple supplements that cover a couple things, but generally no, they don't cover the extras like the dental, the vision, the hearing, or the gym memberships. Now there are some rare occasions where supplements cover a little bit of those, but it's almost not worth discussing. So just for clarification, we're going to say they don't. Supplements generally don't. However, I will say this. If I was to pick a program, I still think supplements are top dog if you can afford it. Would you agree?
Yeah, as far as just the network, because it isn't a network, you can go anywhere. Just the ease. A lot of people like knowing that they have this one monthly premium and then everything else after the deductible is covered. So people like to know that because it's easier to plan versus, well, I don't know how much I'm going to have to pay for this, or what if I have to go to the doctor 4 times this month, or how much is an emergency room visit going to cost? Those are all questions like we don't know exactly, so it's really hard to budget that when you're on a fixed income. That can be challenging versus I pay $92 a month. I know exactly what's coming out of my account. I know exactly what my coverage is, and I know where I can go. So, yeah, it's really hard to say.
I almost don't feel like I should say it's top dog, but it is a personal choice. Mm-hmm. We do have some very successful people that are successfully monetarily that have picked Medicare Advantage plans, and they just feel like they want to. That's probably why they're successful. Mm-hmm. They didn't want to pay a premium, and a lot of times when it's a husband and wife, a lot of times we forget because we have a high health insurance premium. We forget that that's double, and that's double. And if you look at it over the course of 5 years, 10 years, mm-hmm. It is. So the best way to answer that is personal choice. Maybe we need to cut that part.
It's I mean, honestly, with insurance, the best way to answer so many of these questions is it depends. Yeah. It depends on your doctors. It depends on your prescriptions. It depends on what you're looking to get out of it. We had one client who specifically asked for one thing, and that was a gym membership. Nothing else really mattered, just that. And yeah, nothing else really mattered. The copays didn't matter. The dental didn't matter. It was just gym membership. So, yeah.
Hope you got it for him.
We did. But, yeah, so it really just depends on what's important to you, too. So
I think we're going to finish it up. If unless you have anything else you want to add,
no,
I think this is good. Yeah, and
it's
then
a lot of information.
Yeah, because we could go forever, and we got to go back to work.
I had no idea that Cowboy Mitchell was going to make an appearance.
We'll see. We'll see if he makes it into the final edit. We'll see. All right. Till we see you again.
See you next week.
Yep. Bye.